Hello ladies and gentlemen, and welcome to our high-yield pathology question number 39. We have a 44-year-old woman who presents with 4 months of symmetric pain, stiffness and swelling, which is involving her wrists, knees, ankles, and the forefeet. She also reports daily fatigue. Examination reveals joint tenderness, swelling and decreased range of motion bilaterally. A laboratory studies show anemia. This is a classic presentation for rheumatoid arthritis, where you have a younger to middle-aged woman with symmetric joint pain, the swelling, and usually some sort of hematologic problem. And the question is asking which of the following is likely to be the earliest finding in the development of this patient's condition. Choice A, fibrillation of articular cartilage, is incorrect. This is a typical finding in osteoarthritis, where fibrillation simply means fracturing or fissuring of the articular cartilage and occurs due to increased biomechanical stress, i.e. being very obese. Choice B, joint subluxation, is the same thing as joint deformity. Examples being ulnar deviation at metacarpophalangeal joints, swan neck deformities, volar subluxation on the carpus, and many more. However, all of them present in the later stages of the disease, whereas the question is asking the earliest manifestations. Choice C, marginal bone erosions. This refers to a rheumatoid pannus, which is an invasive mass composed of fibroblast-like synovial cells, granulation tissue, and inflammatory cells, which can over time encroach into a joint space, which in addition to articular cartilage can cause erosions of the subchondral bone, but again would be seen in the chronic or later stages of the condition. Choice D, osteophyte formation, also known as bony spurs, that develop at the edge of the bones, particularly around the joint, and are a very characteristic finding in osteoarthritis. And lastly, choice E, synovial neovascularization, is the correct answer. And so you need to know that the pathogenesis of the rheumatoid arthritis primarily involves T-cell response against multiple rheumatoid antigens, most important ones being cyclic citrullinated peptides. And of course, the activated T-cells will release lots of cytokines, promote inflammatory and hypoxic condition, which will then promote synovial angiogenesis to keep up with the metabolic rate of the newly created environment. And that's it for this question. I hope this helps, and follow ConceptRx.